I'm joined here today with Dr. Kelet Robinson, who is the medical director of the new Aurora Wellness Community Health Center. Dr. Robinson, what excites you most about this new center?
As a medical director, I am really excited about starting this clinic from the ground up. So as I mentioned, I've been a family doc for over 20 years now, but what we're used to is coming in and there's an established practice and we're told what to do and how to do it and who our patient panel will be. It's really nice to have the chance to kind of get in on the ground level, choose staff, talk about what the clinic culture is going to be able to steer things one direction or another.
How does the center's community-focused approach help shape the healthcare services you'll be providing?
What the goal is to provide the services that the community is asking for. When I first learned about this clinic, what I was told is that people had gone out and polled the community for 2 years prior just to get information about what was really important in the zip codes that we were going to be serving. And so what we're going to try to do is to offer the community exactly what they are looking for in a healthcare center and adjust things based on what they tell us. So we're not planning to just kind of, sit down and start things up. We want to keep going back into the community and interacting with them and seeing if we are actually meeting those expectations. And if we're not meeting those expectations, then we'll have to adjust our focus and try again.
Do you anticipate any unique challenges when serving this diverse population?
Well, I'm not expecting it to be easy. It is one of the most diverse areas in the country is what I've heard. So there will be people speaking over 100 different languages. There will be people with different life experiences, different religions, different expectations as far as what medical care looks like, as far as what's expected from different gender roles. So I think that may be a difficulty because you can't be all things to all people, but I'm also excited. I think it's wonderful to be able to incorporate all of those differences because differences make us wonderful. It makes us, those things make us unique, and I think that will make us a special clinic. At this time in history, I think there is a unique it's a unique time because people are actually recognizing that facilities like the University of Colorado, which takes up this immense space in Aurora, that we are here on the backs of people who've lived in poverty, people who were enslaved, people who came in as immigrants, who came in and made the land available and did menial tasks so that all of this exists. And I think there is finally some appreciation that, the people who owned this land and worked this land and made things available really are owed something in return. And so again, I think our goal is, if we're going to push that. The goal is that we need to return something to the ancestors of people who made all of this available.